And I have Dr. Paul Redpath joining me this morning from Dillon Ridge Family Dental. How are you doing this morning?
Great, doing really well.
Good, good. Now, I always love when you come in because you always bring like enlightenment and awareness of all these things in regards to dental practices and dental hygiene and all that stuff. So what is it going to be this week?
Oh, this week it's Xrays.
Xrays. Okay. So now what goes on with Xrays as far as like how often people requesting them or denying them?
Yeah. So Xrays are super important for keeping your teeth for the rest of your life. The majority of cavities we see are between people's teeth, and Xrays allow us to be able to see between the teeth. That's where we find cavities early and we can treat them and prevent them from getting bigger. Only like 20% of people floss regularly. So I kind of assume people don't floss when they come in, and I'm like, yeah. But we do it based on patient specific. So some people need X-rays once a year. Some people may only need them once every 3 years, depending on their risk for cavities between their teeth, especially.
Now, I imagine like the cavities in between the teeth, people who have them also probably don't feel them because there's not like a direct like food contact to that point, right?
Yeah, so the enamel, the outer part of our tooth has no nerves, and so you wouldn't feel any pain at all. When you start feeling pain, it's probably too late. It's probably when you need like a root canal or something like that. So if we could treat it before you have pain, before there's any issues, when it's small, then we get the best result and something that's longer lasting and it'll help you keep your teeth. So
now I imagine you probably kind of do sort of an initial X-ray for a new patient, and then that's kind of when you base off like, okay, I can tell this person's flossing, I can tell this person's not flossing,
yes,
right?
Yeah, it gives us a baseline, and then we can determine how often they need X-rays from then, and we could be like, oh, you know, we follow ALAR, which means that as low as reasonably possible, like trying to keep X-ray radiation as low as possible.
Now, I imagine, because I know there's some people that are very, you know, like don't ever want to get X-rays or concerned about radiation and stuff like that. Does that happen even in the dental office?
Yeah, definitely. Yeah, we'll have people that ask us just no X-rays today, and I try to respect people's decisions, and I just have to inform them of what they're actually saying, because sometimes they don't know exactly what's involved with the like how much they're actually getting exposed to.
Yeah, how much radiation is there with an X-ray?
Yeah. So if living just in a high elevation, even Denver, I mean, we live even higher than that, but Denver, you get about 160 times the radiation exposure for one X-ray in a dental office just from your everyday.
Like just because there's a certain level of radiation in pretty much everything.
Yeah, food, the sun.
So just walking around Denver.
Being in Denver, being in an airplane, being up here. So the amount of radiation is very, very low in comparison to just our daily exposure to radiation. So, and now even today it's digital X-rays are 10 times less radiation than film was back in the day when we had films and we had to process it and all of that. But so yeah, we've gotten it down even lower.
So it sounds like it's it's really not much to be concerned about, especially when you consider the preventative benefits and whatnot. Now, so again, you're talking about how often you should get X-rays. That's a little bit different for everybody. So if you're seeing somebody that does floss regularly, like how often do you typically?
It would be, so I've had people that have no cavities. They've never had a cavity. And so every time we see them, we're like, we usually start at once a year. Once a year, we'll take the ones that you bite down on and we check between the teeth for cavities. And then we'll move that to 2 years if you haven't had a cavity in the past year and you have very low risk and you're flossing and everything like that, then we go to 2 years. Then if it's like at 2 years, nothing, and we're looking good, then we go to 3 years. And usually at 3 years is kind of the maximum, because every so often something changes in someone's life, where their diet changes or their habits.
Just bite down on something,
yeah,
the wrong way. And
and you get it like stuck between your teeth. But yeah, it's case specific.
Now, where can people go to find out more information about your services and make an appointment and all that stuff?
Yeah, so we're right by the City Market gas station in Dillon, and we do all digital X-rays, and we reduce as much as possible case specifically, and yeah.
Excellent. Well, thank you so much for coming in and enlightening us about X-rays. Now, folks, go ahead and make sure you make an appointment. Go, floss, take care of your teeth, and have Dr. Redpath take care of you as well.